Howdy folks, it's Dr. Z returning for VEDA 2014, day 21, the viewer special. So there weren't that many comments actually, so it's going to be a shorter video than most, but there were some things that I want to talk about. First, there was a comment from one of my pharmacy idols who told me her own idol was Dr. Michelle Convin from Oklahoma. I looked her up and she's the Associate Professor and Chair of Clinical Administrative Sciences at the University of Oklahoma College of Pharmacy. From my cursory glance, she had an impressive resume, so she's definitely an idol to have. Thanks, Dr. Lupsch. On Facebook, I had a friend ask me 2 questions that are worth answering. First one was, have you had anyone try to scam you yet? Really? Yes. There's been many times. But one quick story was when I was in an Illinois suburb of St. Louis. It's a favorite of mine because it's really so ridiculous. A woman brought in a prescription with 4 regular maintenance medications and 1 pain medication. The quantity dispensed was written as 95, and this is odd, but not entirely uncommon from the office that the prescription came from, until a tech took a closer look. She said, "This kind of looks funny," showing both me and the other pharmacist. When we looked closer, it was actually written for 45, but someone, assumedly she, but someone, put a top on the 4 to make it look like a 9. And this automatically voided the entire prescription, not just the pain one, all 5 prescriptions. So we called the patient over at the consultation window and said, "Hey, ma'am, has anyone come into contact with this prescription other than you?" "Of course not. I held it the entire time between me and the office." "What do you mean?" "Well, it looks like the prescription has been forwarded, which means the entire order is voided. Did you know that's a felony?" "What do you mean? Let me take a look. Give me the script back. Let me take it." No. We're going to keep it and send it off to your doctor, so that way they confirm the quantity. No. And then she bolted for the door. So then we called the doctor's office about 5 minutes after we faxed over the prescription. Once we got in contact with the nurse cut us off. "Look, I have a patient extremely angry, standing right next to me, saying you won't give her prescription back. What? Do you know that that's against the law?" "Ma'am, she forwarded the prescription and we faxed your office about 5 minutes ago." "What do you mean you..." "Oh, yeah, I have it right here." "Well, we'll take care of this," and click went the phone. I haven't heard back from that, so I have no idea what happened after that, but it's always a great story to talk about whenever I floated around with Walgreens. The second question he asked was, what is your favorite type of patient? And for me personally, it's those who are recently diagnosed with diabetes. It's mainly because this is a disease that impacted my family pretty hard, and it's one that I feel that I have the most information to share with my patients. Especially when I see a new metformin prescription, I always ask if they were recently diagnosed. Most often, they were diagnosed and given the prescription with no other information besides your sugar is too high, see me in a week. And they're just kind of walking around like, what is this diabetes? What in the world does that mean? Does it mean I'm going to lose a leg or something? When they see me and I ask them that, they're kind of face perks up and they're, like, what is it? And I talk about their health maintenance, how sugar and insulin impact their life, how physical activity can help decrease their blood sugar and decrease complications. And generally, I always have to mention about how not to take metformin at the max dose because it can really ruin their night. And usually these patients call me back a little bit later, an hour or 2, and they ask me more about diabetes, and I'm more than happy to talk it out with them because they need to know this information. Without it, they're likely going to be scared and unsure, and they may even disassociate from it, and they're not going to make the most fully informed decisions. That's at least one area where I feel that can make the most impact. I know it's a short video, but that's literally all you guys asked me or told me. So I'm going to do another one of these in a week. Hit me up in the comments on Twitter and on Facebook with questions you have for me personally or professionally. I seriously want to answer them. So until then, like and share my videos, subscribe to my channel. Otherwise, I've been Dr. Z, signing out. Have a great night.